Welcome to part 3 of GU. We're going to talk about urinary incontinence. Urinary incontinence affects more than 25 million adults in the United States, and more women than men are affected. It's also more common with older adults. Older age alone does not cause incontinence, but older adult diseases and medications can make the person more likely to develop incontinence. The exact prevalence is unknown, as many people are embarrassed about their incontinence and underreport their symptoms. There are several types of urinary incontinence. There is transient incontinence that appears suddenly and lasts 6 months or less. There's overflow incontinence where the person can't hold their bladder any longer and then urinates without trying. There is reflex incontinence where the person empties their bladder without any sensation of needing to void. There's total incontinence where the patient has zero control over their bladder at all. And then there's stress incontinence. This is very common, and especially in women who had a pregnancy and birthed a child. For block 1, we're going to focus on stress incontinence as it's so common. Stress incontinence is when there is involuntary loss of urine, when there is increased intra-abdominal pressure from things like sneezing, coughing, laughing, jumping, and changing positions. This is usually caused by weakened pelvic floor muscles and ligaments from pregnancy and childbirth in women, abdominal surgeries for any gender, and then prostate removal surgeries for men. Assessing someone for incontinence is really based on history and voiding habits. We need to ask our patients if they have any dribbling of urine, any difficulty holding their urine, or any changes to their voiding habits. Hopefully they'll tell us of any issues they're having, as discussing this can be very embarrassing for them. A urinalysis can be done to make sure there is no UTI present that could be causing the issues. We can also assess the patient's skin for any skin breakdown that could be caused by the incontinence. When it comes to planning and goals for incontinence, what you decided with your patient is really going to depend on the type of incontinence the patient has. No matter what is decided, the person needs to know that managing incontinence is going to take time and effort. There's a lot of education we provide related to behaviors that manage incontinence to help them live their life fully. Part of this education is not waiting to urinate. Once they feel the urge to pee, it's time to go. This is going to decrease the amount of urine in the bladder at all times and lessens the chance of leaking with any stressful situations. Another thing that a person with stress incontinence can do is Kegels. These are pelvic floor exercises that help strengthen the pelvic floor muscles to help lessen stress incontinence. There are even special physical therapists who specialize in pelvic floor strengthening. There are medications that can be used for stress incontinence, pseudoephedrine sulfate, but it should not be used in people with hypertension or males with prostate enlargement. There's also surgery that can be done to tighten loose pelvic floor muscles, but it's not a first-line treatment and other options need to be tried first. Evaluating a person with incontinence is really going to be about their skin and symptom management. Did our interventions help the patient have less episodes of incontinence? Did their skin stay intact? Was the person able to function throughout their day, or did they have issues? Remember that treating incontinence is not a quick thing. We may have to evaluate and reevaluate and try new things many times before the person has less incontinent episodes and can function the way they want to. When it comes to incontinence products, there are several things we need to take into account. First is how functional is the person? Are they going to work, living an active lifestyle, and can complete their own ADLs? If so, they may be able to use absorbent pads or absorbent underwear to collect any leaking that may occur. If the person is bedbound, we may need to consider a product that will not only catch the urine, but also keep the urine off the skin to prevent breakdown. This also means there needs to be caregivers available to change the product and clean the skin. The severity of the incontinence is also something we need to consider. Pads can only absorb so much. If there's a lot of incontinence, the pads may leak, and that's embarrassing for the person, and it can lead to skin breakdown. The gender of the person is also a factor, as some products are only for a female anatomy and some products are only made for male anatomy. And of course, the patient's preference is always a factor. Here are pictures of two common types of in-facility incontinence product. The first one is the PureWick, which is a product for female anatomy that is attached to suction to gently suction urine away from the urethra and the skin. The second picture is of an incontinence wrap for male anatomy, and it helps keep the urine away from the perineal skin. Both of these products are used best for bedbound patients. And this is the end of part 3, incontinence.